did the 1950s polio vaccine, relying on herd immunity. Imagine a time when polio struck fear into families everywhere, causing paralysis and even death. In the mid-1950s, a new hope arrived with the development of a vaccine that changed everything. But did this vaccine relying on the community protecting itself through many people becoming immune? Not exactly. The initial polio vaccine created by Jonas Salk in the 1950s focused on protecting individuals directly. It was an inactivated vaccine, meaning the virus was killed so it couldn't cause disease. When a person received the shot, their immune system learned to fight off the polio virus. The main goal was to give each person immunity, so they wouldn't get sick or develop paralysis. Large-scale trials involving over 1.8 million children proved the vaccine was about 80 to 90% effective. After that, health officials started mass vaccination campaigns across the United States in 1955. The focus was on immunizing each person to prevent infection. As more children got vaccinated, the number of polio cases dropped sharply. This decline helped communities become safer over time, but the initial strategy was about individual protection, not community-wide immunity. Later, in the 1960s, Albert Sabin developed an oral polio vaccine that used a weakened live virus. This oral vaccine could spread slightly from vaccinated individuals to others, creating what's called contact immunity. That helped boost herd immunity, protecting even those who weren't vaccinated. But in the 1950s, with Jonas Salk's vaccine, the main idea was to protect each person directly. Families lined up to get their children vaccinated because they believed in the vaccine's power to stop polio. The success of this vaccine was a turning point, marking the start of the fight to wipe out polio. So, to answer the question, the 1950s polio vaccine did not primarily depend on herd immunity. It worked by directly immunizing individuals, which eventually led to community protection as vaccination coverage increased.